Miss Jenkins, I'm here to do your pulse and respirations. I've already washed my hands and I've closed the door for privacy.
Okay.
And I'm going to begin now. Count the pulse for 1 full minute. Then watch the resident's chest rise and fall for another full minute. One exhalation and 1 inhalation equals 1 breath. Okay, done. I've finished your pulse and respirations. I'm going to go document now. You have your call bill. Anything else I can do for you?
No, thank you.
All right, thank you very much. Wash your hands and document.